Hey, what's up everybody? My name is Brandon Hunter. I'm a board certified pediatrician, pediatric ICU doc. Today talking about cough remedies in children. The problem we have, I've said before, is that kids have 7 to 9 respiratory infections per year, but the medications you can use are pretty limited. For cough specifically, you or I can take Robitussin or Dayquil or NyQuil, but the medications or active ingredients in those medicines like diphenhydramine, codeine, dextromethorphan, they're all pretty much untested in children. There's not good efficacy data, and they have very long lists of potential side effects. You can see them here. And those side effects are more severe in children. So in general, the AAP recommends not giving any of these antitussive or anti-cough medicines to children under 6 years of age. So what do? Well, I'm gonna talk today about common household treatments. I'm gonna end with a single food, all natural, of course, that is as effective as many of these treatments. So let's get right into it. So to start off, if your child is over 6 years of age, then most antitussive or anti-cough medicines can be given to them, but you need to look at the specific labels for that medicine. If they're over 6, it also means they're probably old enough to be able to suck on hard candy and not have a very high choking risk. If the cough is really bad, you need to make sure that they're careful with it, and the risk of aspirating it is there. But otherwise, sore throat lozenges or cough lozenges, and then just hard candy can be effective. Equally so, if you want to have them gargle with salt water, there is some evidence that that would be appropriate and help reduce their cough as well. Of course, giving warm liquids like hot cocoa or cold food like ice cream will also provide temporary symptomatic relief. And then if you're over 2 years of age, you can do one of these mentholated rubs and hopefully make things feel a little bit better. And then finally, it doesn't help for the cough itself, but sometimes if you get a sore throat that's associated with it, then Tylenol and ibuprofen should be given. Tylenol, remember, avoid in infants less than 3 months of age. Ibuprofen, avoid in infants less than 6 months of age. Okay, so those are some good symptomatic approaches, but there is one food that's actually awesome for treating cough in kids, and that is honey. So the idea here is that you can give honey either a half teaspoon, so 2.5 mLs, or a full teaspoon, 5 mLs, to your child, especially before bed is probably the best time to prevent nighttime cough. And you can either give it to them directly, or you can dissolve it in a liquid like a tea or a juice, but this will reduce the severity and duration of their cough. So there's something called a Cochrane review where they look at a bunch of different studies and say, where is the evidence for or against this? And so they looked at this for honey being used for acute cough in children. And they basically found that honey is better, first, than giving nothing or doing the usual care. Second, it's better than diphenhydramine, which is in Benadryl. It's better than salbutamol, which is similar to albuterol, which is a medicine that we use for asthma where there's a lot of cough associated. And then it even suggests that honey is as good as dextromethorphan. So this is the anti-cough medicine in Robitussin, NyQuil, and Mucinex. So that's all really great and why I suggest trying it, but a huge caveat. If your child is under 1 year of age, do not give them honey. So they are not eligible. And the reason is the risk of infant botulism. So basically there's a bacteria called Clostridium botulinum, and it has these spores that can live in honey. If you or I ingest them, we have a developed microbiome. And so those spores actually don't take hold or cause systemic illness. But for babies under 1 year of age, if they ingest it, it can cause infant botulism, which essentially just causes profound weakness. This leads to a weak cry, constipation, poor feeding, breathing problems, and excessive drooling. Now, botulism is much more common in some states because people can also get it through the soil. So I saw this a good deal when I was in Pennsylvania. So if a child does get botulism, it's not a fatal diagnosis, but it often requires mechanical ventilation for an extended period of time where we give an antitoxin and wait for it to work. So that's about it. Just a quick video on cough in kids. And so again, if your child is over 1 year of age and they have a cough, try honey. It really does have pretty good data. It's all natural, easy to give, and enjoyable to kids. The side effects are pretty much just related to sugar, maybe a little bit of anxiety or jitteriness or energy, but would definitely be worth trying. So hopefully that was helpful. And if so, please feel free to leave a comment or subscribe, and I'll see you on the next one.